Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you my top tips for using pain medicine after knee replacement surgery. Before I get into that, if you're interested in everything related to knee replacement surgery, preparation, recovery, frequently asked questions, exercises, rehab, everything else in between, be sure to turn on that subscribe button below and turn on the notifications as we post videos every other day. Now let's get into this. So what are some of the top tips, some of the important things to keep in mind when it comes to using pain medicine after knee replacement surgery? So one is you want to focus on a multimodal approach. And what I mean by that is multiple modes or various modes of pain management. So very specifically, this is in regards to what you're prescribed by the surgeon or the surgeon's office after surgery. So most likely you're going to get some sort of opioid, some sort of prescription pain medicine. But also you're probably going to be prescribed an acetaminophen such as Tylenol, and you may be also prescribed an anti-inflammatory such as ibuprofen. And it's important to use these as part of the management. Pain medicine, opioids, narcotics, of course, have a lot of potential complications. There's the risk of dependency. So we really want to use them appropriately for their benefits, but also we want to be very smart and very strategic about how we use them. So incorporating other modes of pain management can help limit the dependence and the overuse of those medicines. The other thing is be sure that you're following all the instructions from your doctor and your surgeon's office, all the instructions from the pharmacist, and really follow those to a Q. Of course, like I just said, there are risks involved with these opioid medications, so it's very, very important to follow them and follow the instructions appropriately. Now be sure that don't hesitate though to take the pain medicine that you need to take. Sometimes people get over fearful and they don't want to take any pain medicine or any prescription pain medicine, but it's really helpful and really beneficial. It's easier to stay ahead of the pain and keep the pain under control rather than trying to decrease the pain and get rid of the pain after you've had that onset and had that increase of very significant pain and discomfort. There is most likely, for the vast majority of folks, going to be pain and discomfort after surgery. So take the medicine and don't be afraid of taking the medicine that you need as long as you're taking it as prescribed and following all the directions. Now that being said, you can be strategic with your pain medicine use. So the most important thing that I think about is with physical therapy and rehab, if you know that you have physical therapy at a certain time or you're going to go through your exercises and your activities at a certain time, try to plan out your pain medicine so that you're taking it about 30 minutes or so prior to that session. And why we want to do this is because that's going to reduce the pain and reduce that discomfort, and it's going to help you better tolerate your activities, tolerate your physical therapy. You're going to be able to do more range of motion, do more strengthening, do more exercises, and that's going to benefit you in the long run for a speedier, more efficient recovery. So be strategic about your pain medicine and don't be afraid to take it when you need to take it. And if you have pain and discomfort, it's important to stay on top of the pain rather than trying to chase the pain and get rid of it after you already have it. And then the last thing I'll say is as you start to stop taking the pain medicine, if you want to move away from that pain medicine as you rehab and recover a few weeks or so or more after your surgery, be sure you wean off of it. If you just stop taking pain medicine, opioids, over-the-counter prescription pain medicine right away, there can be some withdrawal effects, some negative side effects. So make sure that you slowly wean off of the medicine, and that's decreasing how frequently you take it, how much you're taking. Basically, you want to follow the directions and instructions, again, from your doctor, from your pharmacist. They'll be able to effectively and appropriately tell you how to do that. But make sure that you follow some sort of weaning protocol, as you want to avoid any of those negative complications or negative side effects. So those are some of my top tips. I hope you found this helpful. If you have any questions or comments below, be sure to leave them. Understand that I'm not a doctor, I'm not a pharmacist, I'm a physical therapist, But these are just some general guidelines and general advice I have from working with knee replacement patients over the years. Thank you very much for watching, and take care.